Hello, beautiful people. Are you preparing for your Band 5 NHS interviews? Or you are preparing for your interviews with the care homes? Or you even have a private hospital you're preparing interviews for? This is absolutely for you. Or probably you've had interviews in the past, but you were unsuccessful and you kept on saying to yourself, probably UK is no longer recruiting. That's a fat big lie. UK is still actively recruiting nurses, but you were unsuccessful because you didn't follow the rules, the standard, the values, and everything. In today's video, I will teach you how to smash your interviews with care home, with NHS, or with private hospital in just one attempt. Truth be told, I have passion for helping international nurses because me myself, I'm an international nurse too. So I've helped thousands of nurses smash their OSCE exam in one sitting through my videos. And if they have any issues through my email, you can also contact me. I've helped lots of nurses be able to pass their NHS interviews with my tips. Yes, even Band 6s. If you are interested, stay tuned. Let's get to it.
Ryan Little.
Hello, beautiful people, and welcome back to my channel. If you are seeing my face for the very first time, my name is Nannelle Griselda. I live and I practice in the United Kingdom. So do me a favor, like this video right now so you don't forget. Share this video with as many that benefit from it, and of course, don't forget to subscribe. Now, back to our topic for today. You're preparing for a Band 5 interview. Sit down and listen attentively. You are smart. You are intelligent, you are dynamic, you are eloquent, you are caring, you are compassionate, you have everything it takes. So be yourself, be confident, don't be nervous. One of the very first questions that usually happens in all interview is, number one, tell us about yourself. You know what to say. To be honest, I really don't think you should prepare for an interview. You already have all it takes. I keep telling people, nurses are brilliant. You already have what it takes. When they say, tell us about yourself, let me use the word brag about yourself. Tell them your achievements in nursing. Tell them who you are. If you are the type of nurse that you don't miss cannulation, tell them about yourself. If you're confident, tell them everything about who you are. For instance, when they say, tell us about yourself, who are you in the nursing profession? Brag about yourself. I'm not here to give you answers because it's not something you should cram. It's something you should do. For instance, if you told me, tell me about yourself, I'll tell you, my name is Nannelle Griselda. I have been a nurse for over 14 years. For instance, I am dynamic, I am confident, I am very supportive. I have all it takes to become or to deliver an effective nursing care. I'll tell you what, I have good positive relationship with every member of the team, the doctors, the nurses, the healthcare assistant, the physiotherapists, the occupational therapists. I have good communication skills. I am able to communicate effectively with my patients, relatives, with the doctors, with the nurses, with the dietitians, with the occupation, because you're working with a multidisciplinary team. I'm able to adhere strictly to clinical governance. I am able to make sure infection control standards are maintained at all times. I told you earlier on that I have worked for over 14 years. And in this, my 14 years of nursing practice, I have worked in different aspects of nursing. I've worked in different roles. In my first role as a nurse, I worked in the general and clinical medicine. I learned a lot. I was very good with cannulations. I even led team with cannulations to the extent that whenever they find it difficult to cannulate a patient, I was the one called. I led teams in cannulation. Oh, also, in the second job I worked as a nurse, I was able to work in the orthopedic unit. And in there, I learned so much. I was able to manage pain. I understand symptom management. You don't understand? Brag about yourselves. Tell them who you are. And oh, And to me, I tell you, nursing is about caring. And Virginia Anderson said the unique function of a nurse is to assist the individual, sick or well, in the performance of those activities he or she cannot perform. Look them in the eyes when you are talking. Don't put your eye down. Look them in the eyes. The unique function of a nurse, according to Virginia Anderson, is to assist the individual, sick or well, in the performance of those activities he or she cannot perform, and to help them gain independence as rapidly as possible. And that's something I love to do. I love the fact that my patient come in unwell, and I'm able to put smile on their face. They go back so healthy. I'm able to nurse them to a peaceful death, make sure I manage their symptoms if they are dying patient. Because part of the things you are going to experience here, they have patients who are already dying, who are on the end of life. I'm able to alleviate their suffering. I'm able to make my patients comfortable. I have so much passion for this nursing profession, and each time I see a patient getting better, it gives me so much joy. I love my job. I love what I do. I'm so proud to be a nurse. So I'm not saying these are not things to crowd. These are things you are. Nurses are brilliant. Nurses are caring. Nurses are compassionate. Talk about yourself extensively. And make sure when you are talking about yourself, you are looking at them eyeball to eyeball. Yes, I've helped lots of nurses adapt to the law. Talk about yourself. Who are you? And make sure you look them eyeball to eyeball. Confident. Dress smart. I could go for an interview like this. Am I telling lies, ladies or guys? I could, because I'm looking smart. I'm looking who I am. Nurses are smart people. So that's the first question you are likely to get literally in all interviews. Tell us about yourself. Number 2 question could be, why do you want to work with us? Or why do you want to work with this trust? Or why do you want to work with this care home? Or why do you want to work with this private organization? So read their trust policy. So if you applied for a job, go back to that trust policy. Go back to that care home. Read about their trust values. Read about their trust values. Lots of NHS job, lots of care home job, lots of private hospital jobs. Many of their values is, teamwork, love, supporting each other. So read about their trust value. So read about them, understand the trust value. Oh, why do you want to work with us? Oh, I went through the values of this hospital, or of this trust, of this organization. Oh my God, I was really excited when I saw this, because these are things I love. For example, one of the values is teamwork. So, and this suits me very well, because I'm able to work effectively with every member of the team to be able to deliver patient-focused care that are specific to each patient, in line with Nursing and Midwifery Council and in line with the trust policy. And talk about the values. So read about them and be able to talk about them individually. Honestly, I told you, you are the one saying, "Nurse, we have not gotten a job." You have not passed your interviews. I told you, one of the nurses said to me, "Nurse, I'm an international nurse from Ghana. I'm applying for a job. Nurse, I have not been successful. Now I have interview. What do I do?" By the time I just kept a little voice note, I may not be able to keep a voice note for you. That's why I'm doing this video, because I'm very busy. I have my own family too. And when we talked about it, she messaged me a day or two and said, "Nurse, please do a video. I have gotten a job." Number 2 question. Now, number 3 question could be, what are the qualities of a nurse? What are the qualities of a nurse? One of the top quality of a nurse is the heart to care. Oh, nurses are really caring, and one of the quality of a nurse is to care for your patients. Give them the care they need. Understand your patients. Listen to them. Attend to their needs. Assess them. I have so much passion for this job. I'm able to care for my patients. I'm able to meet their needs. I'm able to assess them and know what the wants are. So talk about the qualities of a nurse. Like I told you, I'm not here to give you the answers. I'm just here to tell you, those things. Bring the game on. Bring your A game on. That's it. Another question they might ask you, for instance, they might give you a scenario. The doctor has prescribed 75 international units of insulin for a patient, and you are the nurse to administer that insulin. What will you do? Of course, we all know 75 international units of insulin for a patient is outrageous. So when they ask the question, remember, look them eyeball to eyeball and smile. Oh, thank you very much for that question. So what I'm going to do is, when I see that prescription, I would not administer that prescription. I would go to the doctor and I will say to the doctor, doctor, this is the prescription for patient A. Do you want to have a second look at it? Because I feel that this dose is too high, with a compassionate manner. Remember, we are working as a team, and the doctor will have a look at it, and probably the doctor will change it. If the doctor does not change the prescription, I would go to the charge nurse and inform her about it as well, and I will make sure it is clarified, because I would not administer an overdose medication to my patients. One of the qualities of the nurse is to advocate for your patients, making sure your patients have the right drugs at the right time at the right route. Did you see? That's a smart answer. That's bringing in your A game. Sometimes they can ask you, if a patient has a fall, what will you do as a nurse? Oh, thank you very much for that question. Remember to look them eyeball to eyeball. Thank you very much for that question. If my patient has a fall, the first thing I would do is to do their baseline observation. I will do their temperature, their pulse, their respiration, their blood pressure, their saturation, and even their blood glucose. After which, I'll ask the patient, can you stand on your own, my darling? Oh, do you want to try? Can you? All right, can you go on your fours? If the patient can stand on their own, I will talk them through standing on their own. And when they have stand up, or when they have stood up, I will do a second set of observation on them. And after which, I will make sure the patient is comfortable. I will let the doctors know the patient has had the fall, for them to review patients and probably send patient for a CT. Okay, and also I will complete a 4 weeks assessment too for this patient. I would make sure I assess patients and make sure patient is wearing a non-slip socks. I will make sure I get a sticker and put on top of the wall that patient is at high risk for fall, and I will make sure we continue to reassess this patient and continue to monitor their observation. If the patient hits their head, I will make sure I complete a neurological observation on this patient. I'll make sure I check them if they know where they are, if they can leave their arm, pupils reaction, limb movement. I'll make sure I complete a full set of GCS observation on the patient. I'll let the doctors know to inform the family that patient had a fall, so that the family is aware, or the next of kin is aware that patient has had a fall, and we will closely monitor patients. If the patient has a bleed, for the management will be done. Now, if the patient is unable to stand up, I would not leave this patient. I will order for equipment that can enable the patient to be able to stand up. For instance, the overjack, and I'll make sure we are able to leave patients, do their observation while they are lying down, get doctors to review them, probably send them for a CT scan, monitor them closely, do a GCS observations on them regularly, make sure a false sticker is placed on top, make sure their next of kin is informed of what has happened, make sure patient is made comfortable, and that's it. Tell us a time where you have worked under pressure. Oh, look at them in the eyes. Thank you very much for that question. I remember 2 months ago, I came on duty and we were just 2 nurses. Perhaps we were supposed to be 4 nurses on duty. I allocated the shift equally between me and the other nurse. We worked as a team. It was so stressful, but we worked as a team. We make sure nursing duties were carried out. We make sure we didn't neglect the patient drugs, because that is very important. Patient medication should not be missed. Do you understand? So that's all about the interview. Tell us about your weakness. When you hear, tell us about your weakness. Say something that you know that will make them love you, will make them attract to you. Oh, thank you very much for that question. I think, honestly, this is a really weakness for me, and I'm really trying to work on this currently. I think one of my weaknesses is the ability to always say yes, even when I'm stressed. If there is extra shift, even when I'm stressed, I like to pick it up, because I don't want my team to let it down. Secondly, if a nurse has called me, even when I've closed on shift, that nurse V or nurse Ella or nurse this, can you come and assist me? I can't say no, because I have so much passion for this nursing profession. But currently, I'm currently working on it because it is important to know when to say no. But for now, I have so much passion for this profession. I find it difficult to say no. Even when I'm busy, I could be busy attending to a patient, I could be busy attending to patient queries, and somebody has called me, can you help me? I can't say no. I will just say, give me 1 minute while I finish. So I'm currently working on it because it's important sometimes we learn to say no. Tell me who will not take you for that weak point. Tell me, what do you mean? So literally, that is it. Interviews. I'll try and do a part 2 video, but I just want you to be confident. This is all about interviews. I'll try and do a part 2 video if you want. If you want me to do a part 2 for interview for band 5 nurses, or you want me to do part 2 or part 1 for interview for band 6 nurses, let me know in the comment section. Until I come your way again, I remain Violet Okalacha. Have a beautiful day. Bye guys.